In today's episode, you're going to learn about gallbladder disease with Dr. George Crawford. Welcome to the All About Pregnancy and Birth podcast. I'm Dr. Nicole Calloway Rankins, a board-certified OBGYN who's been in practice for nearly 15 years. I've had the privilege of helping over 1,000 babies into this world, and I'm here to help you be calm, confident, and empowered to have a beautiful pregnancy and birth. Quick note, this podcast is for educational purposes only and is not a substitute for medical advice. Check out the full disclaimer at drnicolerankins.com/disclaimer. Now let's get to it. Hey, quick note before the episode. If you've been listening and thinking, okay, but how do I actually get ready for birth? I've got something coming for you. It's the Birth with Power Pathway, and it's my new updated online birth course launching this May. I'll walk you through a step-by-step plan to get you calm, confident, and empowered. Get on my email list at drnicolerankins.com/email so you don't miss it. Hello. Welcome to another episode of the podcast. This is episode number 128. I am delighted that you are spending some of your time with me today. So in today's episode, you're going to learn about the gallbladder, and I invited my friend, long-term friend, Dr. George Crawford, onto the podcast to talk about it. Dr. Crawford is the founder and lead surgeon at the Crawford Clinic in Anniston, Alabama. He graduated from Morehouse College. That's how we met. He was at Morehouse. I was at Spelman many years ago. Shout out to HBCUs. He earned his bachelor's degree summa cum laude with Phi Beta Kappa distinction from Morehouse. He was also a Rhodes Scholar nominee. He then went on to get his MD from Baylor College of Medicine and complete his residency at Emory University. In addition to running his clinic, he's on the board of trustees at the Northeast Regional Medical Center. He volunteers through a mentorship program he created for high school students that gives them a practical firsthand experience in medicine. Dr. Crawford also loves inventing. That's one of his greatest passions. He got his first patent at the age of 16. He recently received his first surgical patent, and he has 2 patents pending and is the founder of a biotech company, Modern Surgical Design. And then on top of all of that, he is the proud father of 4 very active children who participate in family hobbies like soccer, fishing, and a host of other hobbies as well. You can follow him on Instagram. He's on Instagram at SurgeryMD. He has about 50,000 followers there, and often in his stories, he shares fun stories about the adventures with his kids, and then he does surgery videos there as well. In this episode, you are going to learn what the gallbladder is, what it does, what are problems that can happen with the gallbladder in pregnancy, some risk factors for having gallbladder disease, as well as how gallbladder disease is treated. I'm seeing gallbladder issues more and more the longer I'm in practice, so I definitely think you need to check this episode out. You are going to learn something about gallbladder disease for sure. All right, so before we get into the episode, let me do a quick listener shout out. The person who did the review is called Hans, and the title of the review says, "Glad I found this podcast." And the review says, "I'm expecting a baby here in the next few weeks, and I felt like I needed some extra information to help me feel more confident. I really enjoyed listening to Dr. Nicole and her guest she has on. She comes to each podcast prepared with really thought-provoking questions. The guest enjoys speaking to her as well. I'm also studying to be a doula, and I think the podcast provides a lot of great information, and I feel like its purpose is to provide enough information not to push you in one direction or another, but to educate you enough for you to make a great decision for yourself and your family." Thank you, Hans, for that lovely review. I so appreciate you taking the time to leave that review, and I hope everything went well with your birth. Now, you are spot on in that I am here to provide information, to help you feel confident, to help you make great decisions for yourself during your birth. Now, you can take it up to another level when you join the birth preparation course. The birth preparation course is my signature online childbirth class that gets you calm, confident, and empowered to have a beautiful birth. It'll help you prepare yourself so you have a calm and peaceful mind. You'll understand your body and what happens in labor and birth, as well as the postpartum period. And you will learn how to advocate for yourself. You can check out all the details of the birth preparation course at drnicolerankins.com/enroll. Over 1,000 mamas have gone through the birth preparation course. I'd love to have you there too. It's an incredible amount of value in the course for what you pay for the price. So check it out, drnicolerankins.com/enroll. Okay, let's get into the conversation about gallbladder and pregnancy with Dr. George Crawford. Thank you, Dr. Crawford, for agreeing to come on to the podcast. Y'all, I'm going to tell you up front, I have known George for a really long time.
Listen, when you said Dr. Crawford, I'm like, why is she talking about my dad? What is she? I'm like, oh, that's right. That's me this time. I got you.
So forgive us if we sound like small children as we talk about the important topic of gallbladder disease and pregnancy.
Yes.
So welcome to the podcast.
Thank you for having me.
All right. So why don't you start off? Tell us about yourself, your work, and your family, if you'd like to.
Yeah. So I am I call myself a small town general surgeon, although I'm really not a small general surgeon. So I do a lot of advanced laparoscopic work, and laparoscopic liver resections, laparoscopic colons, gastrectomies, bariatric surgery. So a general surgery practice, but focuses on laparoscopy. Being in a medium-sized market, because I'm stuck between two academic centers about an hour away, it allows me to kind of do what I want to without a lot of pressure. As far as me, single, 4 kids. One of them's graduating from Spelman this weekend.
Lovely.
And a 14-year-old, 12-year-old boy, and a 8-year-old daughter that just pulls every nerve I have every chance she gets. So,
but she's so cute, though.
That does not help. It's just,
Oh, she's delightful. She's delightful.
Yeah. Okay.
So what training did you go through? I like folks to get an idea of what we go through in our training. So how many years of training did you go through to become a surgeon?
So 4 years at one of the world's greatest institutions, Morehouse College in Atlanta, Georgia. So graduated as a chemistry major from there. Once I left Morehouse, went to Baylor College of Medicine in Houston, Texas, not Baylor University with the football team. And then 4 years there. And from Baylor, I went to Emory University where I did my general surgery training. 5 years.
Awesome. All right. And you've been in practice now for
too
long?
Let me see.
I'm 15 years and I was a little bit behind. So you got to be a couple more.
Yeah. So I started here.
At least 15.
So I started here in Anniston in 2005. So 16, 17 years, something like that.
Okay. Yeah. All right.
Yeah.
All right. So let's get into it. Let's talk about the gallbladder and pregnancy. First off, and I get this question a lot. What is the gallbladder? Where is it? What does it do?
Okay. So gallbladder sits right underneath the liver, which is on the right side of the abdomen. In surgery, we call it the right upper quadrant. What it does is, I know you don't eat fast food or any nasty stuff.
I try not to.
But if you're eating hamburgers and hot dogs and pizza, the amount of grease in that meal is just a little more than your body can handle. So what it does is it stores up bile in the gallbladder. So the liver produces bile, it gets stored and conjugated in the gallbladder. And then when you eat that fat burger or fried pizza, it gives it a little squeeze, the juice comes out, helps your body digest that food.
Love it. Nice, easy explanation. Perfect. So then what are common conditions that affect the gallbladder, and are they different, whether it's during pregnancy or outside of pregnancy?
So I think that's where a lot of people get confused with the gallbladder, because you have gallbladder disease and you have gallstones.
Okay.
Gallbladder disease is when your gallbladder doesn't have the ability to give that squeeze anymore. So think of it like a water hose. Okay. If you take a water hose and you turn the faucet on and stuff's supposed to come out, it works like it's supposed to. But if the pressure is not there and the water is just trickling out, it's building up behind and it causes pain. So most people, when they have a gallbladder attack, it's that gallbladder kind of spasming because it just can't get stuff out and stuff doesn't want to come out. So that's what causes pain. Now, That's different from gallstones.
Okay.
So gallstones can actually block that hose so the water can't come out because it's got a blockage in it. It's got stone in it. So then that pressure builds up, and now that filling and that full sensation is what causes that pain again. So it can either be because it's spasming or it's because it's got so much pressure that it can't squeeze out. You can get into stuff like pancreatitis and all this other stuff, host of problems down the line. But for the most part, that's really what gallbladder disease is.
Gotcha.
Now, the other time it gets a little weird is because about 10 to 15% of the population, probably 20% in America now, actually, they have gallstones. But just because you have gallstones doesn't mean you have gallbladder disease.
Okay.
So if you go to the doctor and he says you have gallstones, it's not like you have kidney stones. It's not the same kind of thing. It's just like, well, if you have them and you're not having any pain when you eat spicy or fatty foods, don't worry about it.
Gotcha. Now, when does gallbladder like infection come into play, like cholecystitis?
Yes. So if the duct gets blocked, either because there's a stone stuck in it or because the gallbladder stopped working because it's not able to squeeze anymore, that's when it can get infected. Now, the other thing you got to remember is that the gallbladder comes right off of the small intestine, right where the stomach and the small bowel connect. So what that means is there's actually bacteria that free floats in and out of your gallbladder all the time. As long as it's squeezing and emptying, it's not a big deal. Because if you think about it, for that bile to come out the liver and then go back up into the gallbladder, it's kind of got to be able to do a two-way street thing.
Gotcha.
And what happens is some people just will get a little infection in there. And then if you can't empty it like it's supposed to, you got a bad gallbladder.
Okay. So what are then some of the symptoms of your gallbladder is bad?
So the classic story is right upper quadrant abdominal pain, radiating to your back, worse when you eat spicy or fatty foods, nausea, not necessarily vomiting. If it gets really bad, your urine can be dark. If it's just your stools can be light colored, your skin can turn yellow. You can have real bad itching. Those are kind of bad signs, so like fevers and chills. But for the most part, epigastric or right upper quadrant abdominal pain and nausea, sometimes 30 minutes after you eat hamburgers or pizza.
Or spicy, greasy sort of stuff.
Yes.
Got it. So how common is gallbladder disease in pregnancy?
So instead of giving it an incidence, what I'll say is a gallbladder removal or laparoscopic cholecystectomy is the second most common non-obstetrical operation that occurs during pregnancy.
Really?
Yeah. First is appendicitis. And it's funny. I believe that the incidence of gallbladder disease is higher in pregnancy than the incidence of appendicitis. But I think the trick is that appendicitis, we automatically, as soon as you think somebody has appendicitis, you send them to the surgeon. You're like, hey, we got to rule it out, find it, take it out. Because it's clear that sepsis infections has a known risk to the mother and the child.
Right.
With gallbladder, what happens is, you got that first trimester, y'all are always worried about, is this hyperemesis? Is it just nausea associated with the first trimester? So it could be that, or it could be gallbladder. So it's kind of hard to say which one it is or it isn't. And a lot of times, I think a lot of those gallbladder patients just kind of get grouped into that first trimester nausea and vomiting.
Sure.
And then by the second and third trimester, they've just like, oh, well, this is because you're pregnant. It's not a big deal. And it gets missed. So we don't take out as many gallbladders as people actually have gallbladder disease during pregnancy.
Gotcha. That makes a lot of sense, actually. We do most often tend to think that it's related to nausea and vomiting or pregnancy.
Yes.
Let's talk about something most pregnant women aren't getting enough of, omega-3 DHA. The recommendation is over 200 milligrams a day, but less than 5% of pregnant women in the U.S. meet that. That's one of the reasons I love Ritual's Essential Prenatal. It has 350 milligrams of vegan DHA, plus other key nutrients like methylated folate and choline to support baby's neural tube development. As an OBGYN, I appreciate that Ritual goes beyond the basics. The formula is science-backed, third-party tested for heavy metals and microbes, and every ingredient is traceable. And the delayed release design, it's gentle on the stomach, something that really matters, especially if there's trouble with nausea during pregnancy. You deserve to know exactly what you're putting into your body, especially when it comes to prenatal multivitamins. And with Ritual's dedication to traceable science and sourcing, you always will. See for yourself with 25% off your first month at ritual.com/Dr. Nicole. Start Ritual or add Essential Prenatal to your subscription today. That's ritual.com/Dr. Nicole for 25% off your first month. So what puts you at a higher risk for having gallbladder disease? Are there any risk factors that other than eating spicy fatty?
Other than not doing what you're supposed to,
yeah.
What else? I mean, realistically, high cholesterol does. That's one thing, and that's something that you can probably definitely treat before getting pregnant. Being overweight, which is a national health problem in the United States, at least, also puts you at risk. The funny part about gallbladder disease in pregnancy is most of the patients, if you talk to them, they probably were having attacks around that first pregnancy or even before they were pregnant.
Right.
Kind of blew it off.
Right.
And then they get pregnant again.
Right.
So a lot of the patients that I take their gallbladders out that are pregnant, it usually occurs during the second pregnancy. But then when you start talking to them, they all had clear classic signs and symptoms during the first pregnancy and just kind of didn't do anything.
Right.
From a pregnancy standpoint, I would say, if you have those symptoms, or if you're kind of like, when I was eating, KFC and it did bother me during my pregnancy, at least let me go get my gallbladder checked out in between the first and second one. I think you'd see a lot more people that are actually suffering from gallbladder disease during pregnancy that just get missed.
Got it.
So I would say that's the biggest thing, is to check in between the two pregnancies if you're having two pregnancies.
Yeah. Yeah. What about the old, and y'all don't roast me for this.
I'm going to let you say it. No,
I know.
I'm going to let you say it. I'm not saying
we used to learn in medical school that the risk factors were female, fat, fertile, and 40. Is that it?
Yes.
Yeah.
Yes.
Yeah.
Yes. And so it's weird. Female, yes, without question. The majority of gallbladders that I take out are females. When you are a classy physician like myself, we say obesity. We don't say fat.
Correct.
But, the problem now is, especially in the state of Alabama, 1/3 of the population is obese. Mm-hmm. So, it's everybody's got it. So, and that's probably the biggest risk out of all of that, other than being female, I think. So it's kind of hard now. So now just everybody's at risk for it. And the other funny part is that I probably take out one, maybe two pediatric gallbladders.
Pediatric?
Oh yeah. The youngest gallbladder I've ever taken out, I took out a 9-year-old.
Oh my goodness.
Because again, they're female and now they're overweight.
Right. Okay.
So,
okay. All right.
It happens.
So how is it treated?
So traditionally it's laparoscopic cholecystectomy, or taking it out laparoscopically through small incisions. It used to be called laser surgery. Every once in a while, if you have someone that, for whatever reason, they're high risk pregnancy, or not healthy enough, or have a lot of stuff going on and you can't take a gallbladder out, there's a medicine called Actigall that basically thins the fluid that makes up bile in your gallbladder, and that can help dissolve stones as well as make it easier for the stuff to come out. Again, think of it as, going back to that water hose scenario. If you can make the water a little more wet, I know that's kind of one of those things I always talk about on the internet is water wet, but if you can make the water come out a little easier, then you wouldn't have as much of a buildup in pressure. So Actigall does that. It wasn't really used as a favorable medicine in pregnancy up until it became more favorable recently. But in the past, we didn't do that. Everybody just kind of, it sounds bad, but I mean, I know, this in OB, we just kind of blew it off until the baby delivered. We kind of, it's not something we're proud of, but that's what we used to do. So.
Yeah, I have to say it depends on the surgeon. Obviously you are more up to date and progressive and understanding that we have to take care of the pregnant person in order for the baby to be healthy. But I still have some surgeons who are like, but what about the baby? And it's like, well, her gallbladder is infected. She's going to die if you don't take it out. So will you please take it out?
Right. And I think the funny part is that even here, I mean, we have a bunch of general surgeons, and I am probably, there might be one other guy that will do it, but a lot of the general surgeons just like, no, send him to George. They just don't
feel comfortable for whatever reason.
Yeah, but part of it also is that we kind of got crappy training in residency when it comes to OB patients. At least from most, I mean, you wouldn't see it because you're an OB, but from every other specialty standpoint, we were just kind of like, oh, OB's taking care of it. Don't worry about it. You don't need to learn it. Just call it OB.
Right.
And that kind of puts that patient population at a detriment because you then have people that don't want to take care of them.
Sure. So what are the risks of laparoscopic surgery in pregnancy?
So it depends on what you're talking about. If you're going in the first trimester, it is actually early termination, spontaneous abortion of the fetus. If you are looking in the third trimester, it's usually early delivery. As far as during the second trimester, that's like the honey spot. That's where we always want to take it out because the baby is secure enough in the uterus to where we're not worried about an early delivery. And at the same time, they're secure enough to where developmentally, where we're not as worried about having problems with the CO2, having problems with anything. The crazy part is that a gallbladder, I'm going to ignore the baby for a second, and then I'm going to come back to the baby.
Sure.
Okay. So if we ignore the baby and we just look at the mother, a laparoscopic cholecystectomy is just as safe in a pregnant woman as it is in someone who is not pregnant if the surgeon knows what they're doing and they start by putting their trocar in the left upper quadrant.
Got it. And guys, that's all about the placement of the surgical instrument. It's really about understanding the pregnant person's anatomy and adapting the surgery to that.
Yes. Now, once you start throwing in the fetus, you then have the host of, then you start getting into anesthesia. You then start getting into the medicines that they're using. So there are some risks there. But again, most of those we've kind of worked out over time. And, the other tricky part is how long to monitor the fetus after surgery if you're having to do it in the third trimester before you send the patient home. Remember that time I called you? I think I sent you a text message, and I was like, because let me tell you what happened. So I had this lady. She was 33 weeks pregnant, and I kind of got mad at the OB because dude just kind of left me hanging. I was like, your lady's sick.
Right.
She needs a gallbladder out.
Right.
And he was like, well, you just do what you got to do. I'm like, that is not something I can put on the chart. I can't say, the OB said, do what I got to do. So that's my thing. So he was just, I was like, and then I was like, ma'am, do you want me to ship you? She was like, no, I'm not going anywhere, Dr. Crawford. I'm like, okay. So that's why I called you, because I was like, I just need to know. But But that's the thing is, so that kind of made me mad. But
and we really should work together. Like that is completely
yes.
inappropriate. Yeah.
Oh, absolutely. And especially when, my part of the procedure takes anywhere from 5 minutes to 30 minutes and I'm done. The rest of it is making sure that the mother and the child are safe.
Sure.
So it's recovery time. It's follow-up with their OB. There is the making sure I'm not writing for something crazy that can cause the patient and the fetus a problem. So a lot of that is OB care. And it's just weird sometimes when people are like, oh, well, it was just good luck. I'm like, dude, it's your patient.
Yeah, exactly.
You're the OB.
Exactly.
What?
Exactly.
Come on, family.
Not appropriate.
But, yeah. And part of that, I think, is that when you start getting into that third trimester, the OBs get a little kind of jumpy because they know that the baby can come early. So they kind of want to avoid that as well. Versus the second trimester, everybody's on board. But I think that's also because it's a lot safer in the second trimester than the third trimester.
Sure. But in general, to be very clear, on balance, if it needs to come out, it needs to come out.
Oh, absolutely. Yeah. Mm-hmm. And that's the thing is that, I probably, so if I have someone in the first trimester and they're not gaining weight like they're supposed to, or the fetus is not measuring from a growth standpoint the way that they're supposed to, and they have gallstones and we kind of tease through it and they have signs and symptoms before, I will do it in the first trimester. And I just have to, usually what happens is the female comes in without any other family support. So when I'm doing a first trimester cholecystectomy, I say, okay, well, we're going to do this next week, but I need you to bring your husband, your boyfriend, your mama, your wife, whoever in so we can have this conversation together so they understand what we're doing and why we are doing.
Right.
And then if you do that, most people are like, and I do that with third trimester as well. But if you do that, most people are just kind of like, okay, do it. Everybody's on the same page. And I say, hey, look, worst case scenario, if we do not do this and you get sick and have a problem, we lose you and the child. I'm not asking you to make a choice between you and your child, but I'm telling you is that if something happens, I would rather lose one of you than both of you. And from my standpoint, I have to do what takes care of the mother, and what takes care of the mother is best for the family, which also includes the child.
100%.
And most people get it once you put it that way. They're like, okay, that makes sense.
That's how I always frame it. Like in order to have a healthy baby, we have to have a healthy mom. Yes. And if you're not healthy, then the baby doesn't stand a chance. Not everybody is comfortable having that conversation, I would say. Right. So, are there ever any times though, where you are like, okay, we can wait and do this like right after you deliver or shortly after you deliver? Are there any other options? Is it ever an option to wait?
Oh yeah. Listen, no, you're given an option. I'm gonna wait.
Okay. So if you're talking about taking it out, then it's like, it's
yes.
This is the option.
yes. But if you come in like, yeah, I got a little nausea when I eat Starbucks or whatever, I'm like, well, stop eating Starbucks. If that works, leave it alone. You'll be fine.
Right.
But, and most of those patients will say, look, but 6 weeks after that baby comes out, you and I are going to dance. We're going to get this thing done. And you would be surprised. Probably about 80% of the patients I have that conversation with do show up around 6 weeks.
Okay.
And they're like, let's get it done.
Let's do it.
Right. Because again, if it happened in the first one, it's going to happen with the second one.
Right. That makes a lot of sense. So what can people expect after the gallbladder is removed in terms of like physical recovery? And then also like what happens to their body when they don't have a gallbladder anymore?
Right. They turn green and look like Martians. No. So laparoscopic cholecystectomy done safely traditionally has a recovery time of about a week. They're going to be most tender at the umbilical port. For two reasons. One, the uterus is pushing up on it anyway, so it's stretching it just because of pregnancy. And two, that's where we bring the gallbladder out. So with that's going to be the most tender site. And it's also the largest incision that we make. Now, after you get over that pain, which usually lasts about a week, there's about a 4 to 6 week time where you still can't eat spicy or fatty foods because you have phantom pain. Your body basically says, okay, the gallbladder's still there. And then part of it saying, no, it's not. So your body has to have time to figure it out. And eventually that goes away. And we usually, there's not really anything to do with that. It just takes time. And you just kind of have to slowly introduce those favorite foods that got you to where you were in the first place.
Gotcha.
Anesthesia is kind of weird, is that laparoscopic cholecystectomy now, the anesthesia recovery is almost harder than the recovery from surgery. Just
really?
because if you think about it, we're giving you all these medicines, your body's got to metabolize them, you have to, get back to homeostasis or the way that your body normally runs. And when I do a gallbladder, I have a 1 centimeter incision in the belly. A 1 inch incision in the belly button and a 5 millimeter incision on the side. And that's it. So the incisions themselves are small. The inside of your body, doesn't really feel pain like the rest of your body does.
Right.
So a lot of it is just patients are tired because, even though they have the growth of a fetus, you now have this metabolism downregulation from the anesthesia, but your body needs all of this energy to recover. So it's this weird kind of, I'm tired, but I feel better because I can eat, but I have a loss of appetite just because my body's trying to figure out that the gallbladder is gone.
Sure.
So it's not so much the physical surgery, but once you add the anesthesia on there, it's a little bit different. Okay. Most of my patients, after about a week, they're pretty much doing fine, except for the changes that go along with their diet. Every once in a while, and this is probably not so much a pregnancy issue, an issue for patients that have the gallbladder removed during pregnancy, is that sometimes you have what's called post-cholecystectomy syndrome. So you can have diarrhea or constipation depending on how your body deals with the increased bile salts that are now coming out because your gallbladder is gone.
Okay. So they're still coming out of your liver.
Yes.
They're just not being stored anymore.
Correct. And your body it depends on how good your liver is. If you were in college drinking way too much in Morehouse College and doing stuff like that, your liver probably doesn't function as well as it used to. It may have a little problem downregulating and upregulating over time after your gallbladder is removed. If you're over here eating vegetables for all of your life and you just studied at what was that, Brawley? Where did you stay when you were at
Spelman?
What was that? Yeah.
Oh, I was in LLC.
LLC. Oh yeah, yeah.
LLC 1 and 2. Yes.
Yeah, you fancy. I forgot.
Of course.
Honor student and all that stuff.
Of course.
So if
okay,
you
like you weren't also.
Hey, this is not about this is not about me. This is your podcast. This is all about you. We're talking about you now. So, if you're living that good LLC life and, eating healthy, and, you have a pretty good diet and your liver functions great, and you just happen to get a bad deal with a bad gallbladder because your mama gave you, your mama had a bad gallbladder, her grandmother had a bad gallbladder. Take your gallbladder out, you're ready to go.
Okay.
Without any problems.
Okay.
So it's really person specific.
Got it. Does it run in families?
Why are you going to ask me that?
I mean, just curious.
Okay, that's like I'm going to say sort of. I'll say this.
Because maybe it's related to families having the same diet or similar.
Yeah, everybody's eating the same nonsense.
Okay.
But, but part of it also, goes to that question of, if you eat a lot, is your cholesterol high because you eat a lot of cholesterol, or are you one of those people that genetically are predisposed to having high cholesterol regardless?
Gotcha.
There's that component as well. And there are hormonal differences. No one's hormone level, especially in females, is the same. So, if this one has a little more estrogen and progesterone versus this person, does that put them at a predisposition to having a bad gallbladder? Possibly, but how do we regulate? You know what I mean? There's no magic number.
Right.
If I had to guess, I would say yes. but we haven't pinned it down yet.
Okay. So is there anything people can do to reduce their risk other than having a healthier, balanced diet? Is there anything they can do to reduce their risk of developing gallbladder disease?
Lose weight.
Okay. All right.
I mean, if you're decreasing the cholesterol in your diet, you're staying away from the red meat, a lot of dairy, a lot of fried foods, and you have a high fiber intake, you're doing everything you can. So, but also the funny part is if you're doing all that, you're probably not going to be overweight anyway. You're probably going to have a pretty healthy diet. This is not for mothers. This is for children. Make sure that if you have kids that are involved in sports, especially in hot climates like the South, make sure that they drink a lot of fluids. One of the biggest reasons we see bad gallbladders in kids is from dehydration.
Interesting.
Yeah.
Okay.
So, you'll see patients that are thin. I have a thin 16-year-old female that comes into the office. She has a bad gallbladder, and you look at the mom, and she's, maybe she's overweight, and then you start talking to the mom. Well, my grandmother had it out, my mom had it out, I've had mine out. Why is she getting hers out at 16 and we have ours out at 30? It's like, well, because she's dehydrated. We're like, oh, okay.
Got it. Okay. I will say that in general, I feel like I have seen over the years more folks need their gallbladder removed in pregnancy. It seems to be increasing.
Well, I think part of it is also we're doing a better job of it.
That's true.
I think, when we used to have to put big wax on people when they come away with a big incision and in the hospital for like 4 or 5 days, everybody's like, I'm not putting a pregnant lady through this. Ventral hernia is going to, all this stuff versus now.
You go home the same day.
Yeah. Same day. Same day.
Yeah.
Same day.
Yeah. Oh, I guess I should ask, how often do you convert to a bigger surgery? Knock on wood, hopefully.
Me or everybody in general?
How about in general?
In general, I would say the conversion rate is probably the average general surgeon's conversion rate is 5%.
Okay. And guys, by conversion, I mean, like, you can't do it through the tiny incisions. You have to open it up to a bigger incision, which is a longer recovery, more pain. You're in the hospital longer. It's way more complex.
Yeah. Routine gallbladder, 5%. If you're looking at somebody that has stones stuck in their duct or something that's, I call it a gallbladder plus, it's probably 10, 15%. But most people don't have gallbladder plus. That's a whole different ballgame.
Okay. All right.
Mine?
Yeah. What is yours? You want to say it or you want to spoil
less than 0.1%.
Nice.
Because I know what I'm doing.
Well, good. I would hope so. All right. So just to wrap up, I ask everybody, all of my guests who comes on these questions. What is one of the most frustrating parts of your work?
It is the fact that healthcare is a business and not a right. I mean, not a right. It's, you know what I mean?
It's not something that we prioritize that people should have.
Right. Everybody should have health
without having to be broke for it.
Correct. You should be able to walk in the hospital, get care taken care of, walk out, and not worry about a bill. There should be, whether it's, and it's stuff like co-pays. I have patients that are like, hey, my gallbladder's hurting, but I can't get it out. I got to go to work, or I don't have time off at work, which is kind of crazy. Or I can't afford my $5,000 deductible, which again is kind of crazy. And, you just get frustrated for all the hoops that we have to jump through to help people take care of themselves.
100%.
So, and it's a no-brainer that people are not doing stuff that they're supposed to if we're putting stepping stones in front of them, obstruction, not stepping stones, but we're just putting blocks for them to have to navigate around just to get taken care of, And it's just, it gets to be a pain in the back. And it's not just insurance companies, it's hospitals, it's physicians, we're all kind of part of it, and it just gets frustrated.
Yeah, for sure. So on the flip side, what's the most rewarding part of your work?
2 things. One, is the main reason I got into general surgery, and I'm not dogging any other specialty, but in general surgery, we fix people. People come in, they have a problem, I fix it, and they leave. It's like a one night stand all over, and everybody leaves happy, satisfied. It's the best one night stand most of these people are ever gonna have in their life. They're like, see me in the Walmart, they're like, Doc, hey, you did my hernia, you did my gallbladder, good to see you. Man, this is, such and such. So it's like I'm giving out one night stands left and right, and I'm like 100 for 100. And I just like fixing people and knowing that they get well and move forward. The other part is kind of a weird one. I live in a small town. So, I'll go somewhere and I'll run into a patient and, they'll say, hey, doc, such and such, thanks for taking care of my grandma. She passed, but you did everything you could. We really appreciate you being straightforward with us. Or, hey, thanks for taking care of my daughter, such and such. And they say that when my kids are with me. And, every once in a while, my kids are kind of like, Dad, dude, you help a lot of people. I'm like, dude, it's important. So being able to live in an environment where my kids can see me doing good work and see people acknowledging that, I think that probably is the selfish part of helping people that I truly enjoy.
Yeah, I like that. Love it, love it, love it. So if you had to give one piece of advice to a pregnant person who has gallbladder disease, what would you say?
So just make sure that you research your symptoms, and if you can, hone in on the story before you go see your OB so that you can help your OB understand that this may not just be the nausea and vomiting associated with pregnancy, that it may be a bad gallbladder, because you will save yourself a lot of misery during the pregnancy. And if you think you've had gallbladder disease and you're planning a pregnancy, I would consider getting it tested, get your gallbladder tested just to make sure that it's not an issue before you get pregnant. Or if you get pregnant, you're out here in the streets doing what you're not, doing whatever, and just end up pregnant. Between the first and second pregnancy, and if you have problems, make sure you at least address the gallbladder issue ahead of time, so you don't end up in a situation.
Yeah, great advice, great advice. So where can people find you? I know you make a lot of surgery videos. You have like 50-something thousand followers on Instagram.
Yeah, one or two. I can't remember.
And if anybody who's interested, I have a fair number of like students and things like that who I think would find your videos helpful. Or if you're just interested in surgery stuff, where can people follow you and watch what you do?
So I'm at Surgery MD on Instagram. I don't like to read, so I'm not really on Twitter. And I have a YouTube channel. It's called the Crawford Clinic, and it pretty much goes over a host of general surgery topics. We do a little bit of talking, a lot of videos. So if you want to see dead feet cut off, or if you want to learn how to do advanced colon surgery, that's a good reference. Some of the videos on YouTube are more geared towards healthcare professionals, because I'm a professional education proctor for Ethicon. And so I have to go around teach people how to do gallbladders and colons laparoscopically and other little fancy stuff. So some of that content is how to learn to take out a gallbladder or colon. So, but if you just want to learn how to take out a colon in your basement and you got all the equipment, it's a good reference.
Oh my God.
Cut off a foot. You need a license in most states. I'm just saying you need a license in most states.
I cannot.
But if you just I'm just saying, if you just want to learn how to do it,
you got them. You can teach them.
Sometimes you need extra skills just in case you never know what's going to happen. And, you end up somewhere and they got all the equipment and you want to know how to take a gallbladder out, I got you.
Oh my God. Oh my God. Well, thank you, Dr. Crawford, for coming on and educating us about gallbladder disease.
My pleasure. Thank you.
Okay, wasn't that a great episode? I bet you learned something about the gallbladder that you didn't know. I know that I did. All right, after every episode where I have a guest, I do something called Nicole's Notes. And here are my Nicole's Notes, which are my top 3 or 4 takeaways from the episode with my conversation with Dr. Crawford. All right, number 1, if you need surgery or tests in pregnancy, you need surgery or the test in pregnancy, okay? I know that everyone wants to focus on the baby, and understandably so, but sometimes there's a loss or people don't remember that in order for the baby to be healthy, the mom has to be healthy. That can be especially true with specialists who aren't obstetricians, where they're like, I'm not touching anything with a pregnant woman because I'm afraid I'm going to hurt the baby, without remembering that in order for the baby to be healthy, the mom has to be healthy. So we don't do surgery, we don't do tests or things in pregnancy unless it's absolutely necessary. So if you need it during pregnancy, you need it during pregnancy. Remember that in order for your baby to be healthy, you have to be healthy. Okay, point number 2. Dr. Crawford talked a lot about how gallbladder disease is influenced by what you eat. And when you eat foods that are considered, less healthy, that can exacerbate or make gallbladder disease worse or, make it happen. I want to remind folks that pregnancy is an opportunity to maybe improve your health and your diet. I know there's the old, pregnancy is a time you can eat what you want because you're pregnant. And we need to rethink that. Pregnancy can actually be an opportunity for you to make different food choices in order to have you be healthy, have your baby be healthy. So think of pregnancy potentially as an opportunity to improve your health and well-being, especially your nutrition. All right. And the third point that I want to make is that in relation to his frustration about healthcare, and healthcare it just really shouldn't be so complicated. Like, nobody should go broke from needing healthcare. People should have access to affordable healthcare. It really shouldn't be that difficult. This is where policy and advocacy are important. This is where paying attention to what's happening in politics is important, because that has a huge influence on policy and the things that happen in healthcare. So I would encourage you to keep your eye open for things like that if it's something that's important to you. And it really should be important to all of us that everyone has access to affordable healthcare. Pay attention to the policy and things that are happening in your state and on a national level. All right. So there you have it. Be sure to subscribe to the podcast in Apple Podcast or wherever you're listening to podcasts. I'd love it if you leave a review in Apple Podcast. I do shout outs from those reviews from time to time, and I love to hear what you think about the show. Also, do check out the birth preparation course, drnicolerankins.com, so you too can feel calm, confident, and empowered for your birth. That's drnicolerankins.com/enroll. Actually, I forgot to put the ending there. All right, so that's it for this episode. Do come on back next week. And until then, I wish you a beautiful pregnancy and birth. Thanks so much for listening to this episode of the All About Pregnancy and Birth podcast. Head to my website, drnicolerankins.com, to get even more great information, including free downloadable resources on how to manage pain and labor and warning signs to look out for after birth. You'll also find information on my free online class on how to make a birth plan that works, as well as everything you need to know about my signature online childbirth education class, the birth preparation course. Again, that's drnicolerankins.com, and I will see you next week.